We're at the IAS 2018, and we're here with Assel from Kazakhstan. We just completed a press conference, and the press conference was discussing the AIDS Fund and the Elton John Foundation getting together and doing some funding for you being one of two recipients, awardees. Initially. I mean, there'll be others, I imagine.
Yeah.
But we wanted to invest a little time in understanding what you're going to do with this money and how you believe you're going to make a difference.
Right. Okay. So we are very delighted to get this award, and we are hoping to use this money to expand HIV self-testing for men who have sex with men and transgender people in Kazakhstan.
And so the people that are being the people that are being served really are not being served any other way at this point. Is that correct?
Well, they are being served. We have a network of AIDS centers in Kazakhstan, but people are so stigmatized and they're so afraid of being identified and discriminated, so they don't want to go openly to HIV services. That's why we think that self-testing might be a better option for them.
So the way in which you're going to serve the people is going to be a little different.
Yes.
Yeah. And will you be able to reach a lot more people that way?
Yes, we are going to use social media and internet to reach these communities. Nowadays, young people are mostly using social media. And I know that MSM community is actively using social media in Kazakhstan. So we are hoping that we will be able to reach more people through these channels.
Do you work in concert with the clinics right now, or?
Yes, we are constantly working with government clinics and laboratories in Kazakhstan. Our work is primarily research on different health issues, but mostly HIV, TB, mental health for among marginalized communities and key populations like injection drug users, sex workers, and MSM. And doing research, we always partner with government organizations and AIDS centers and NGOs on the ground.
Do you have any pushback from the government on the work you're doing?
Well, we have difficulties in integrating our work into the real practice. We develop effective interventions, and then we have to disseminate them on the ground. So there is some resistance from the government to accept this into their real practice. And sometimes we propose some innovative solutions and evidence-based practices. For example, for injection drug users, using some new treatments, for example, for their drug abuse, and this is not accepted by the government. But we are working with them.
So there is criminalization?
Yeah, there is a criminalization of drug use, of course, and MSM issues are also criminalized, unfortunately.
So are you working, is there this balance between you getting invested in not being too political important, or can you become political enough to get maybe some changes made in some of these areas?
Well, as a research organization, we are definitely trying not to be very political because we do research and we report on things that we see. And we see objectively because we test people for different diseases. We also survey people and we report the things that we observe. And sometimes governments don't like it, but like this is the fact, and they cannot object it. Yes. For example, we reported the findings on the migrant situation in Dushanbe, for example, in Tajikistan, because many people from Tajikistan are coming to Kazakhstan, and the government didn't like the findings. But but
It is what it is.
Yeah,
it is what it
this
is.
is what they have.
So what other areas are you working in? Is this mostly, as far as the funds go, this is directly where it's going to go, is to serving people and media?
Yeah, with the funding from Elton John
Right.
AIDS Foundation, yeah, this is the first time we receive funding from Elton John, and this is the first time they come to the region. So we are going to direct it for MSM work in Kazakhstan. We have done studies on MSM. We have good access to this population, and good understanding of how to reach them. So we hope that this will be another channel how we can help them.
You know, something that wasn't mentioned or even discussed or even asked by any of the questioners at the press conference was something that I would have asked. I didn't, but Elton John's celebrity is there. It's
Yeah.
obvious, and he is well loved by the people. You know,
Right.
and I'm thinking that if he were to make a commercial or found some other people, local celebrities, to make a commercial or call it a discussion, and then have it on television or YouTube or whatever, to really enlighten people about the realities and misperceptions
Yeah.
of treatment and prevention and testing and care and so forth. Is this something that you might be able to address with him and his organization? Because I can only tell you that would be what I would be doing right now.
Yeah.
He might as well use himself for the things he's good at, and that's one thing. If people have confidence in him, they have confidence in other local celebrities or notables, maybe even sports figures,
Right.
that you could use them to, in the very best and most tasteful way, to tell the realities and misperceptions of treatment and care and prevention. So it's,
Yeah, that would be, I think, very important things to do. In Kazakhstan and in the whole Central Asia, I don't think Sir Elton John ever visited our country and our region, so that would be a very nice thing to do, because I think he can actually attract attention to the problem, and he can raise trust and interest from the public figures, as you are saying. It's yeah, I know that international organizations like UNAIDS are trying to invite celebrities and sports figures to promote and advocate issues for HIV, but it's been difficult. It's been difficult to do because because HIV is still very stigmatized in the country, and Kazakhstan is still very conservative, like Muslim country, where the issues of drug use and sex work is very difficult to discuss openly.
yeah, it's sad, but it is, like we said, what it is.
Yeah.
Yeah. Well, I know that it's going to take time to change, and but we can't wait. We have to go with what we have now.
Yeah.
And as soon as you are able to, I'm sure that things will change and improve, and the funding will go a long way to helping you, I'm sure.
Yeah, thank you. We also hope so for that. Yeah.
Well, thank you so much for being here with me.
Thank you very much.